Coronavirus cases are rising across most of the U.S., and in the past week, new cases are up by 66%, and infection rates are going up in more than 36 states. Less than half the country is fully vaccinated, and the highly infectious Delta variant now making up more than 50% of those new cases. Health officials say the speed of the spread is worrisome. Pfizer is meeting with U.S. regulators today about the need for a third dose of its COVID vaccine. The company is saying protection fades over time, but health officials don't think another shot is necessary just yet. Stephanie Whitfield looks at who might need a booster shot soon.
For months, people have wondered how long protection from COVID-19 vaccines will last. Pfizer released a press release a few days ago saying its phase 3 study shows immunity drops after 6 months, so it's already time for booster shots. But the FDA and CDC quickly pushed back, saying there's no need for a third dose right now. For most people, the vaccine still does a good job of preventing serious illness and death. Here's who Dr. Scott Gottlieb says may benefit from a booster.
I would suspect that if there is a recommendation on providing boosters, it's going to be for a select portion of the population, perhaps people who are older, who are more than 7 or 8 months from completing their original vaccination. It's not going to be a general recommendation for the entire public.
Pfizer says it's already seeking authorization to use its vaccine as a third dose. Health officials say they'll only make a recommendation after the company's data is independently reviewed and analyzed. That being said, most health officials agree Americans will need a booster shot eventually, just not yet. Perhaps in the fall or next year. Stephanie Whitfield, KHOU 11 News.